Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. All right, welcome back to the Equine Vet Connect podcast. I'm Dan Carter here in Countryside Equine Hospital with Dr. Caitlyn this morning.
Good morning.
I've been told to take my glasses off, so for those of you watching on YouTube, now my glasses are off, so they're not doing whatever it is glasses do on the camera. But yeah, we're back here in the old studio, old treatment room 1. If you ever come in to see us, you will recognize.
This is where the magic happens.
It is. We tried moving the magic once, me and Caroline did, and the magic did not happen over there. So we came back to where the magic happens.
Yep.
So, all right, today we got a pretty cool episode. This is probably this is up there in my favorite things.
This is like your bread and butter.
It is. It's what I do all day, every day, and I wake up every morning. This is why I went to vet school.
Yeah.
And I'm probably one of the few people that said, I'm going to go to vet school because I want to do lameness in sports medicine. Mm-hmm. Went to vet school, and I do lameness in sports medicine. Mm-hmm. I feel like there's a lot of people that think that's what they want to do. And then when they get in there, they find something else that just really trips their trigger. And they're like, I'm going to go do that.
Yeah.
I mean,
it takes a very specific mind to do lameness in sports med. I don't have it, but it's cool though.
It is, and it's what I've always found interesting. When you look at vets, if they're really good at lameness, breeding is not their jam.
No.
And if they're really good at breeding, lameness is usually not their jam.
Yeah.
Like the two don't.
They don't mix.
They don't mix.
Yeah.
And I think it's just a whole different thought process.
It is.
I mean, I'm sure there's a few out there that cross-pollinate, but like for me, the thought of breeding anything, I'm just like, ugh.
Right. Today we're going to talk about soft tissue injuries in horses. So
love them.
Yes.
Well, I should say this. I love treating them.
Yes.
I love fixing them.
We don't love them for the horses.
I hate that they happen.
Yes.
And
but we love treating them. They're fun.
Yep.
They are fun. They're fun to diagnose too, because you go through and you're like, there it is. There's your answer. Mm-hmm. So we'll kind of start off like, what is a soft tissue injury, Dan?
You know, a lot of people, they always say soft tissue, and I always say that's like saying the horse is lame. Mm-hmm. There's a lot of soft tissue in the body.
Yeah.
It can involve muscles, usually a little less commonly. Mm-hmm. Usually we're talking tendons and ligaments, and there's a lot of those in the body.
Yes, there are.
And I can remember when I was in vet school, we knew about like 3 that actually cause problems.
Yeah.
And with advanced imaging, we've now learned that there's a whole bunch of them that cause problems. Mm-hmm. And I think that's the cool thing is, when I became a vet and started down this road, it was right when the information just exploded.
Yeah.
And it's just been a really cool time to be involved in this because, used to you bowed a tendon. That was a soft tissue injury. You bowed a tendon. Mm-hmm. And it was this big, huge, fat tendon.
Yeah.
And that was a soft tissue injury. Now we're finding the reason some of these horses, like there were horses we couldn't get diagnosed that were lame, but we're now finding all these other, we figured out, they've been there the whole time. Mm-hmm. We've finally been able to diagnose a lot of these other smaller structures that really do cause a problem. So it's your tendons and ligaments.
Yeah. And
they're the rubber bands that hold the body together and make horses move. I mean, without them, they don't move.
Right. A tendon is something that connects like a muscle to a bone, whereas a ligament connects like to like technically. So bone to bone, cartilage to cartilage, cartilage to bone. Those are your technical definitions. But when you actually get into the anatomy, some tendons act more like ligaments because of how they're attached and certain things. But essentially, they connect bony structures and muscular structures, and they if you say you do a cadaver lab with tendons and ligaments, you can move the whole limb just by moving that tendon. So that's the mechanics of what makes the horse move, essentially.
Yeah, I like to think like ligaments hold everything together, and tendons make you move. That's a general assumption.
That's fair. Yeah.
Because the one that we hear the most about, the suspensory ligament, which I love, because I do think this is the ligament that makes a horse, because it's sort of the sling around the fetlock, and it's really cool because it goes back to what you learned in that 3rd grade science class, about potential and kinetic energy. And it's like when a horse loads that suspensory, we're storing that as potential energy, and then it actually recoils in kinetic and makes a horse move. And that's how they can actually cover long distances with very little muscle input. It's because that ligament's constantly loading and unloading, and they're going to store that energy, release that energy. And to me, it's just fascinating.
It is. And you have, when you go through like distal limb anatomy, there are so many tiny little structures like collateral ligaments and like your check ligaments and everything that goes into making that leg, one, hold it all together, and two, make it move appropriately and make it move with strength and stability and efficiency. It's really it's a marvel, honestly.
And I think that's the other part, is when you look at the size of a horse, and then you look at the size of some of these collateral ligaments.
They're tiny.
That are holding this thing together. And to know that collateral ligament's the glue that keeps this joint held together, and it does it. It's amazing. I don't know.
Well, that's like when you look at lamina in the hoof on microscope. You're literally looking at these teeny tiny little Velcro finger-like projections that they go this way and then they go this way, and that's literally what's holding the horse up off the ground in the foot. It's just crazy. Anyway, it's just cool. We're just nerding out.
The equine leg just
it's crazy.
I think that's where my fascination, because I started as a farrier. And we dealt with the foot, but then we were also on some of these tendon and ligament injuries. We started getting involved. We were involved with the veterinarians on different things we can do shoeing wise to assist with this. And I think that was one of the things that drove me to become a vet, because I was just fascinated by how all this worked. And the nerd in me kicked in, and I was like, well, I need to go be that guy.
I just remember being in equine anatomy in my 2nd semester, first year of vet school, and I was like soaking it up like a sponge, because I was like, this is what I've always wanted to learn. I'm so excited.
I know, it's so cool.
But we're going like we always do. So I guess the most common injuries that we hear now, because we're much more advanced than just our bowed tendon now. So what we've got basically tears, sprains, and strains. So a sprain or a strain is going to be less severe than a true tear, and Dan can kind of go into the differences between those guys.
I think to really get into this, and I'm going to nerd for a minute. To really get into this, you need to understand what makes up tendons and ligaments. They're made of collagen. Collagen's protein structure, and collagen is literally what holds the body together.
It's the connective tissue glue.
Yes. And there's a specific type of collagen, type 1 collagen is what we term it. That's what makes up these tendons and ligaments. And when you look at them ultrasound, they're very straight fibers that start at an origin and go to an insertion. So the top part where it originates, that's your origin. It's going to extend down the limb, and it's going to insert somewhere, and that's what we call the insertion point. And on ultrasound, they look really straight. And if you were to look at them just grossly, these fibers are also straight, going from top to bottom. But then when you look at them microscopically, they're actually Z's. They're tiny. It's like this big, long accordion going all the way down the leg. So when we talk about the stretch in the tendon and ligament, really what's happening is you're taking this accordion, stretching it straight, and then it recoils back to its shape. And I'm not even going to get into disulfide bonds and how this works, because it's really cool, but that's a chemistry nerd that I'm going to leave out for right now.
It is really cool, though.
But that's your stretch, your quote unquote stretching of the tendon or ligament, is that accordion going from crinkled all the way down to straight. Now, what can happen is if we go past straight in that collagen, because once that collagen fiber gets straight, it has no more elasticity. Collagen is not the most elastic structure in the world. It has some, but not that much.
The more elasticity you have, the less strength you have, so you have to kind of balance those two.
Correct. Correct. When we start losing that, that's a bad thing. So when that ligament or tendon, that Z, fully stretches, if it stretches too far, strings break. So what I like to equate it to is tendons and ligaments are like ropes or cables, these long fibers. And if you get too much strain on a rope or a cable, you're going to start getting breakage of the individual strands. Mm-hmm. And when those individual strands break, that's when we have a tear. And then how many of those strands break is how severe the tear is. Mm-hmm. We see this on ultrasound. It'll be black. And this is developed of a core lesion. This is a true tear. It'll be like a black hole inside the tendon or ligament. Maybe Casey can throw a picture of a core lesion up there. And for those of you watching on YouTube, if you're not watching on YouTube, you're missing some cool stuff. But or what's that?
There's a video on Spotify.
I just found this video on Spotify too. Mm-hmm. So yeah, I'm learning stuff. So video, if you're watching this and not just listening, it's on there. But check out a video. So a core lesion is where you actually get breakage of those fibers.
Yeah.
And that's your more severe of them. And then how many of those fibers break is important, because when you think about those fibers actually breaking, if you break enough of them, it puts more load on the other fibers, and then you can get more fibers breaking. And so this can progress pretty quickly. But that's probably your worst. That's your true tear.
Yeah.
Then we can get into these fibers are all held together by these tight cell junctions called hemidesmosomes. Mm-hmm. And so they're all linked together. Sometimes what we get is a separation. Those hemidesmosomes break and we get a separation of those fibers. And that's more of your sprains and your strains. Like you have this, we call diffuse edema, mm-hmm. but you're not seeing a true core lesion. You're not seeing an actual tear. And those are your more acute type injuries. Mm-hmm. More often when we're looking at sport horses, because of the nature of the work, we get into more of the chronic situation. And that's where we've had these repeated sprains or strains. We've repeatedly pushed the tendon or the ligament a little bit further than it should go, mm-hmm. and it tries to repair itself. And when it does, we'll get into this later in more detail, we get a lot of what we call fibrosis in there. And so we get this mangled mess of fibers, and that's not very strong tissue.
Yeah.
But that's sort of your over-nerded view of what's the difference between a tear, a sprain, or a strain. Sprain and strains are kind of like, well, how bad was it?
Yeah.
And that's why it's important when you're doing these workups to be able to know how this looks on an ultrasound, those mm-hmm. subtleties. It requires a really good ultrasound, and it also requires a lot of training.
Yeah.
Do we have a core lesion, or are we dealing with diffuse disruption, more of a sprain or a strain? Because that's going to vary how we treat.
Yeah, and that's something that, it definitely takes time and repetition to get that skill, because I know it's something that I come to you all the time. I'm like, can you look at this and tell me what exactly I'm looking at, and like, now what do I do? And it's a very fine tuning and figuring out exactly what you're looking at. So, but I mean, thank God we have the ultrasound.
Yes. And I'll tell you the ultrasounds of today, I think back to my first ultrasound, and it was light years ahead of anything else on the market. This mm-hmm. thing had hit, and it was portable. You're used to these machines were massive console units. And then we started getting these smaller units, but what we were sacrificing image quality for portability. And then GE and Sonosite started launching these high quality portable ultrasounds, and that really changed the game.
Yeah.
And I look at, we've still got my first GE that's now 15 years old. We've still got it here at the practice. I've scanned with it in the last year or two just because sometimes it's sort of fun. And it was a fantastic image, still produces a good image. But now look at the machine I'm using now, this next gen by Sound, and the image quality and what we're able to see is just remarkable.
Yeah, especially with your teeny tiny little probe. That thing is,
that's an 18 megahertz probe.
It's fantastic.
It doesn't penetrate very deep.
No,
however,
it's lovely.
It is really cool.
Yeah.
I love that probe.
So how do we get these soft tissue injuries?
I think the biggest place I see it, and again, I'm dealing with a sport horse population. Mm-hmm. And this is going to be different than if you're dealing with a racehorse population. Yep. But in the sport horse, in the sport horse realm, the bulk of them that I see are chronic repetitive injuries. And what I like to think about is every time you exercise a horse, when you're exercising a horse, you're going to get some kind of damage to a structure. It's just part of life.
It's just like when you exercise yourself, you're inducing you have to induce some sort of muscle damage to get muscle growth. Right. Yeah.
And no different than us, we're going to get some kind of minor tendon ligaments. It's all the same. You're going to get some kind of injury to it. Yeah. But the body repairs that. And it repairs it while we sleep. It repairs it while we're at rest. And the body's able, let's say, just making up random numbers, let's say every time you exercise, you get 5%. You injure 5% of your tendon or ligament. Well, the body puts that back together before you exercise the next time. The body just heals. Yeah. And it's amazing, like the growth factors and the way the body can do this. And so the body heals it. And we just move on with life and everything's great. But let's say we have the ability to heal 5% of a tendon. And these are all random numbers I'm making up for example only. Yeah. Let's say the body has the ability to heal 5%. Well, we push it to 7. The body heals 5. Well, so now we're 2 points behind. Yeah. Next time we exercise, we only hit 4. It puts it back to, we're only 1 point behind. But then let's say we keep going to 7. And we keep going to 7 and healing 5. Well, now we're losing 2 points every time. And then eventually the horse becomes lame. Yeah. And the body is no longer healing back with normal tissue. It's healing back with fibrosis or scar tissue. And that fibrosis or scar tissue is just not very strong. Yeah. And eventually over time, these become injuries. So at first, it's not an injury because the body's fixing it. But we keep pushing harder and harder, and we get these... we start to get weaker tissue in there, and then we finally have an injury. And I think that's why people are like, well, he's been fine. How could this been going on? Well, it's been slowly occurring. And I think that's the most common type of injury I see. Yeah.
Do you think that like footing conditions and shoeing and everything plays a role in that, or?
Everything plays a role. Deeper footing is going to be more of an issue for soft tissue than firmer footing.
I think about like walking on a beach. Your legs are always more tired if you're walking on sand than...
I make the comparison all the time. You got high tide sand, which is that really soft, loose stuff, and you go for a walk or a run, you're exhausted. Yeah. Then you have the low tide sand, where it's more packed down, and you can walk forever. It's nice and forgiving, and that's the comparison I give to people. Like when you're trying to determine what kind of footing or what kind of condition the footing is, just imagine you're at the beach. If it feels like high tide sand, this is deep. If it feels like low tide sand, you're in great shape because it's got a little bit of cushion, but it's also firm. Yeah. And it's kind of like a Goldilocks deal. You don't want it too hard. You don't want it too soft. You want it just right.
Yeah, because your harder surfaces are going to have more like concussion on your bony structures, whereas your deep sand is going to be harder on your soft tissues. So it's always a little bit of a balance.
Well, I think looking back over my time in dealing with sport horses, we started out, we had joint issues. And so we're always focused on getting this footing softer to try to help out with these joint issues. And then the pendulum kind of swung where we got too soft. And we started getting too soft, and then that's when our joints were doing better. Yeah. But our tendon and ligaments weren't. Yeah. And now we're kind of swinging back the other way, and I think we're getting closer to the middle. And then depending on the footing, this is where your farrier can help you. Because depending on the type of footing you're working in, you're showing in, because depending on your breed, you're going to have different arenas. Depending on the discipline, you're going to have different types of footing. Your farrier needs to be aware of that, so they know how to set your horse up to be more successful in that. When I was shoeing, I would set horses up completely different to, if they're going to be showing and competing in artificial footing, I would have those horses set up differently than if I knew they were competing in a natural footing. And most of the farriers, they pay attention to this. Yeah. And it's similar to, if you've ever seen, if you ever look at cleats, let's talk about baseball because that's probably the biggest difference. If you're playing on grass, dirt, natural tight footings, you have metal spikes on your shoes. All right, your cleats are actually metal, so they can dig in and penetrate. And then if you look at a turf cleat is nowhere near the same as a regular cleat. That turf cleat's got a much smaller, it has more, I guess, more cleats, but they're shorter and smaller. And it's to grip the carpet. And so it's the same way with horses. Like, you have to set them up differently for where they're working. We can do a whole episode. I need to get somebody on, and we do a whole episode on chewing in the different footings.
Yeah.
But, yeah, footing, big thing on footing.
Yeah. So if we're trying to avoid the acute on chronic or the chronic repetitive injuries, how do we increase healing after work?
You know, I think this is where you've got to look at your training programs. And this is, you know, I've probably spent the last, I spent the last 15 years studying injuries and figuring out how to treat and heal them. And I'd probably say the last 2 or 3, my mind, again, I've kind of, instead of changing how I think, change the way I look and the way I see. And now I'm seeing my role is how can I help people try to prevent these injuries? Like that's maybe where, that's where I'd like to go, because yes, I treat a lot of these, but what can we do to try to prevent?
Yeah.
And I think, you know, I look a lot at what professional athletes do, because these guys are playing at a really high intense level. And this is studied. You know, they've got athletic trainers, massage therapists, chiropractors, orthopedic surgeons.
And they're seeing them regularly.
Yes.
It's insane.
They're in the clubhouse with these people.
Yeah.
Like, they're there every day. That's their whole job, is to keep this group of athletes functioning. And so one of the things I look at is you can't, NFL plays 1 game a week. Right, 1 a week.
Yeah.
They're not playing 5.
And they're not practicing full tilt every day.
No, they don't practice full tilt every day.
Yeah.
And I look, a lot of times we have these horses and we're expecting them to, like I use the example of more dressage, we're expecting Grand Prix every day. And sometimes we don't need to be Grand Prix every day. We need to have fitness routines.
Yeah.
When you come off a heavy show schedule, like you're showing a heavy weekend showing, you need to back things down.
Yeah.
Maybe this isn't the time to go back out there and jump. You know.
Same thing for the hunters and the jumpers. Like, you do not need to be jumping a course every day. You've got to work on your groundwork and work on your flat, and then, you know, and then go maybe pop over a cross rail or do a gymnastic a couple times a week.
Right.
And then jump a course.
Yeah, it doesn't need to be full tilt, 1.60 meters.
Yeah.
You know, you may have a 1.40 meters horse, but jump those at the show.
Yeah.
You know, once your horse knows how to do this, we don't need to do this every single day. That's what eventually leads to these injuries, is we're going 100 miles an hour every day.
Yeah.
You need rest days. So you need some days in the week that we're not riding, and we need to space those out. It doesn't need to be like, oh, I'm gonna ride, you know, Tuesday through Sunday or Wednesday through Sunday. I'm just not gonna ride Monday, Tuesday. We need to space some of these gap days out. And then also, it doesn't necessarily have to be, I'm going to do nothing today and just stop. Focus on lighter exercise. Maybe we're walking, we're trotting, we're doing a little bit of canter, but maybe that's not a full collected canter. Yeah. You know, we're going on, I love a trail ride or a hike. Love it.
It's good for the brain too.
Good for the brain. It's good for the body.
Yeah.
But we just need to exercise it out. You know, that's why if you look at a lot of these NFL players, they're going to go full tilt on Sunday, and maybe it's walk practice on Monday, Tuesday. You know, they're going to slow things way down because they got to let these guys heal. But they don't need to just sit on the couch and do nothing.
Because then you get more sore.
Right.
Yeah.
So we're going to slow things down, have a really light exercise where the body's still moving. And I think people forget, walking your horse builds strength no different than trotting, cantering, anything else. Like, walking can build strength as well.
Yeah.
And just getting the horses moving. And the other thing is, I think oftentimes too, and I'm not saying anything bad about weekend warriors, but when we forget about our horse Monday through Friday because life gets in the way, and then we're going to compete like crazy on Saturday and Sunday, but we're not maintaining that fitness during the week, this is going to set us up for this is going to increase our odds of having an injury.
Yeah.
So too much rest is a bad thing, and too little rest is a bad thing.
Yeah. Conditioning and fitness is a huge factor for sure.
You've got to think about them like athletes.
Yeah, they are.
You're not. It's not just a horse. You have an athlete.
Yeah.
And depending on the level you're at, you may have an elite athlete. And I use the example all the time. An NFL player looks, their workout, their routines, what they're doing looks completely different than the guy playing middle school football. It's two completely different scenarios because of just the intensity.
It's very different.
So
yeah,
I think knowing limitations and being honest with yourself, this is what I can put in, so this level I can get to. Does that make sense?
Yeah.
So.
Yeah, I think so. How do you feel about as far as like recovery after work? How do you feel about ice?
Oh, this was an aha moment I had. This was definitely an aha moment. I'm gonna tell a little story. My son, he plays baseball and he pitches. In pitching, it's all about arm care. And I remember he finished a middle school game, and it was probably the hardest and most he'd ever thrown. He'd been doing the things fitness wise to be able to throw like that. We really work hard managing his arm, but he threw a big game. And I remember the coach looking, I was like, hey, you need to get your arm iced down tonight. And I don't know why. I think even though I work in horses all day, I was like, do we need to do that? Like, it was the first time I started questioning, like, okay, it's because it's my job as his dad, because, he was 12.
Yeah.
And so I'm like, all right, as dad, I got to make sure I'm helping take care of him.
Yeah.
And so I said, hold off on that. Let me find out what we need to do. And I'm kind of fortunate because I do have a lot of customers that are in that realm of professional sports, whether they are professional athletes or help take care of professional athletes. So I made a phone call in the truck, and thankfully this person answered, even though it was like 7 o'clock at night, and I felt guilty calling, but they told me if I ever had questions to call. So I was like,
no, I have a question.
I got a question.
I'm going to call.
Yeah. And I was like, and it was great because they're like, you always answer the phone when I call you, Dan. So I answered when you called, and I was like, what do we need to do? And I said, they're saying ice. And they're like, we've learned to do different. They said, and it made sense. The body, when you do have small injuries, the circulation needs to increase to those areas. And that circulation is going to bring, like we talk about when we treat these, I'm sure everybody's heard of like platelet-rich plasma. Platelet-rich plasma is just where we pull blood and harvest the growth factors out of it and inject it back in.
Yeah, we harvest all the good stuff out of the blood.
Yeah.
Yeah.
So when that circulation goes up, that's the body's way of pushing more growth factors, pushing more fibroblasts, pushing more of these cells that heal. That's pushing it into the structure that's been overused.
Yeah.
And so when you ice a leg or when you ice an arm, you get vasoconstriction. You actually decrease circulation. That's how it reduces swelling. Well, when we do that, we're not getting those necessary growth factors to heal.
Yeah.
And when this person went through it with me about my son's arm for pitching, I was like, holy crap. Why didn't I think of this? I work in this every day. This is what I do.
Yeah.
But it's not out there anywhere.
And when you look at a tendon or a ligament in a leg, the blood flow to that area is already minimal.
Right.
So we're trying so we need to increase that blood flow that's already at the bare minimum. But then if we ice it, we're taking that down to like nothing.
Right.
Yeah.
So we're taking down even more.
Yeah.
And so this is where I say there's these differences. Like if you have a really bad injury, obviously, like if you have one of those, like you can look at the leg and like, holy crap, that leg's bowed.
Yeah.
We have bowed a tendon.
Yeah.
All right, now we have way too much.
Yeah.
All right, now ice is a good thing. But just normal everyday workouts, I'm big on like, let's don't ice.
Yeah.
And in pitchers, what they use is a J-band workout. And so if you think about it, you warm them up and then you have to cool them down. And they use J-bands or resistance bands. And they're actually using those to stretch the tissue out, put them through slow workouts. So now when my son finishes pitching, he's got an entire routine he does with using J-bands to cool that arm down.
Yeah.
And so what I tell people is like coming in after a hard workout, let's don't ice, but let's go walk. So if you spent 30 minutes, like I tell people, like look at a 1-to-1. If you spent 30 minutes warming up, you need 30 minutes to cool down.
Yeah.
30 minutes is lighter exercise, reducing it. It's walking, it's moving through, it's allowing the body to circulate, and it's allowing them to push these growth factors in so the body can heal from whatever damage happened during the ride. Even when we say that damage, we're talking about microscopic stuff that's not causing injury. It's just normal for workout.
Yeah.
So I'm not an ice fan. And I was a huge ice person. I mean, I was like, you should have game readies.
Yeah.
You need ice boots. I mean, there was all these things that we thought were doing great.
Yeah.
And in that moment in time, 3 years ago, my whole way of thinking changed.
Yeah.
And I think we're constantly learning. And that's one of the areas that we've really learned. So, yeah, I'm going to say if it's just a normal workout day, don't ice that horse.
Yeah.
I'd rather you go cool it down on a good walk. Cool that horse down. Even if you take him in, untack him, clean him up, and then you go hand walk him later.
Yeah.
Do something to bring that horse down.
Yeah. How do you feel about like the red light therapy and the beamer and all of those things?
So when we talk about beamer, pulse electromagnetic, I'm going to go ahead and tell you, there's a podcast we did early on with Dagny. She's a biomedical engineer. She did a deep dive. I'm going to go ahead and tell you, go watch that podcast if you want to know about it, because
it's a really good one.
It's a really good one.
Yeah.
I understood it, but I still don't understand the level that she does. And I would tell you, go watch that podcast.
Yeah.
We get into red light therapies. One of the things when you look at all these therapeutic lasers is they do help increase blood flow. They do help increase circulation, but it has to be the right one.
Yeah.
If you're throwing 2 AA batteries in there and shining a red light on it, we're not getting past the skin.
Yeah.
Here we've got a class 4. You need penetration depth, so you got to be a minimum of a class 3. Class 4 is better.
Yeah.
And so I do think they help. I've used them on myself. You can actually feel the heat. Whether they've tried doing thermography cameras, and most of that, unfortunately, you're just seeing skin temperature. But we do relate that to what's going on deeper in the leg.
Yeah.
So I do think laser therapy works.
Just has to be the right one.
Right.
Yeah.
Two AA batteries and a red light. We're just shining a red light on it. So
yeah,
that's my thought now.
Yeah.
It might change just like the ice did, but currently that's my position.
What are your thoughts on people putting like boots and wraps and things on when they ride?
I'm not the biggest fan.
Okay.
I've
heard so many mixed opinions. I wanted to pick your brain about it. So.
Yeah. And I think when you look at boots and wraps, you got to look at what they're doing.
Yep.
Splint boots, because some of these horses will hit their legs. Splint boots, absolutely. Let's keep them hit their legs.
Yeah.
Do I want a brace on the leg? Absolutely not. Because you're basically applying a crutch, and there's the old saying, what you don't use, you lose. And I think when we get into some of these sports medicine boots, some of these wraps, we're trying to support the leg, but we're not allowing that leg to build its own fitness.
Yeah.
And to me, you should practice harder than you play. And so you should be always preparing to play. And so when we add those crutches or those braces, I think we actually weaken structure. So I'm not the biggest fan. Like I said, when it gets into splint boots, absolutely, let's don't have our horses hitting their legs.
Yeah.
But other than that, not a fan.
Yeah.
I do think sometimes afterwards wrapping some of these legs is not a bad thing. Sometimes we need to wrap some legs afterwards, but during exercise, I don't like it. Let's go build strength.
Yeah.
People don't think about tendons or ligaments getting stronger.
They do.
But they do. Collagen gets more dense.
Yeah.
So, and you need that stress in order to do that.
And that's a part of the rehab process too, is you've got this thing that's filled in, but you've got to put some stress and some strain on it to get it to heal back to its normal strength. And its normal density. So, okay, so we've done all the things, and we're trying to avoid these injuries. But what do we do if we get one?
I think there's a couple things. We have the acute treatment, and then we have what we need to do to heal it.
Yeah.
We're going to do kind of a broad overview because I can do. We've talked about it a little bit with Renovo.
Yeah.
and we'll do some deep dives into that. But your first thing is like, let's talk about the worst. Mm-hmm. Let's say you come out of the ring and all of a sudden you got a big swollen leg. Mm-hmm. You're like, crap, I bowed this tendon. I have injured this tendon. That's when a couple things you want to do. One, get on the phone with your vet.
Yep.
Like, my people know I'm going to answer you on a Saturday, mm-hmm. because I know you're at work, you're competing. This comes up, I want to be a part of it.
Yeah.
So when you get that swollen leg, talk to your vet. One of the first things I do is, all right, we need to get some anti-inflammatories on board. If this thing's big, hot, and swollen, we need to get some anti-inflammatories, because a little bit of inflammation is good.
Too much inflammation is bad.
Too much is bad.
Yeah.
Because if we start to get fluid accumulation inside of that tendon or ligament, and think of it like splitting wood, all that fluid accumulates and we start stretching those fibers apart. Mm-hmm. We're getting a lot of edema. Those fibers are stretching. Mm-hmm. All right. And then again, we talk about, if we tore some of those, other fibers are now picking up that load. So this is when I'm like, hey, a brace is a good thing. We don't have crutches in horses.
Yeah.
But we can use wraps. Mm-hmm. And so wrapping this leg, getting pressure on it, mm-hmm. trying to minimize that swelling is a great thing. Using an anti-inflammatory, butyramine. I actually really love Equiox on tendons and ligaments. I really love it, and we've got a protocol we use for that. It's off-label, so I'm not going to talk about it on here, but I've got a protocol we use. But I want to start focusing on calming that down, and so I'm going to get some anti-inflammatories on board. We're going to make sure we wrap this leg nice, snug, and tight. Mm-hmm. So you're traveling, you're competing, make sure you've got good standing wraps, good quality standing wraps, because you may need them.
Thick cushion, even feel, like good standing wraps.
Yes, good ones.
Yeah.
This is when I will talk about ice. Mm-hmm. Right, so this is where I'll look at ice boots. I want to look at alternating ice, no ice. Game Readies. I used to love the Game Ready system because
they don't make it anymore, do they?
They don't.
Yeah, I didn't think so.
But it was fantastic when you actually had these injuries of cooling these things down. So I do think, having some ice boots, handy. We're not going to use them often, but when we need them, we need them.
Yeah.
But kind of what we call cooling that leg down and trying to reduce some of that inflammation. That's your like acute management. Mm-hmm. A lot of the ones we see aren't nearly as acute. But calming those things down, getting an appointment with your vet. One of the biggest things I used to hear a lot, and I don't hear it near as much, is like, well, he went lame, we noticed a little swelling, so we wrapped him, we gave him some bute and a week off, and he was fine. So then we started working him again. And you hear they went through the cycle 2 or 3 times, and then it broke. Well, that's because, you kind of got it held together, but it was not structurally strong.
Yeah.
So, get in touch with the vet. Make sure you've got a good leg vet, a good lameness vet.
Yeah.
Get in touch with them. You go ahead and get in. Let's get it looked at. Let's find out what the problem is and what it looks like. Because some of these, if we can stop them at that quote-unquote sprain or strain stage, we can do a little work then. Mm-hmm. We can save ourselves in the long run.
Yeah.
Once you do have one of these, it's important to kind of characterize what type you're looking at. Is this an acute injury? Is this a acute on chronic, where we've had some chronic changes and we have chronic injury that eventually became acute? Mm-hmm. We can look at fiber patterns on the ultrasound and get an idea of that, because you're going to manage those two differently.
Yeah.
If I have a really acute injury, we're going to have some time. We're going to focus on getting over the inflammatory phase, mm-hmm. and then we'll start to heal.
Yeah.
This is where we're looking at. I may have you ice, some anti-inflammatory, some wraps. We may do that for a couple weeks. And then we're going to dive into our treatments. So treatments can...
There's a whole list.
Yes. And I'm going to give you all the basics of this all.
Yeah.
All right, I'm going to sum up regenerative medicine really quickly. Nothing changes how fast something heals. Yep. The body can only heal so fast. Mm-hmm. You can only crank collagen so fast. We can improve the quality.
Right.
What we mean by that is, if we get a lot of that type 3 collagen that develops, that's scar tissue. Mm-hmm. That's the equivalent of yarn.
Yeah. Not
cable, not string. It is yarn. It's not strong. The body initially wants to lay that down and patch it and get, say, all right, we're just going to patch this.
Yeah.
we'll heal it later because we got to run away from a bear. Because horses still run away from bears and lions, okay?
Yeah.
They don't realize we don't have to get away from the bear or the lion. So you're going to lay down a lot of that fibrosis or scar tissue, and then it'll, over time, remodel to a type 1. When we get into regenerative medicine, we're trying to skip that type 3 collagen phase, and we're trying to focus the body to lay down more of that type 1 collagen and actually repair the injury, not, actually regenerate it.
Right, not slap a temporary Band-Aid on it.
Right.
Yeah.
So given the type of injury where it's at, it's going to focus when we start that. Some of these more chronic, like acute on chronics, I'm going to start treatment a little bit sooner. They're really acute ones. Like I've seen a lot of these really bad, like superficial bows, deep digital flexor tears. I got to focus on quieting that thing down, because if I throw a regenerative in there, like if you start with the PRP or the stem cells, the Renovos, the shock waves, you're basically using a really expensive anti-inflammatory.
Yeah.
It's just focusing on anti-inflammatory. It's not doing anything to heal this. Until we get over that inflammatory stage, we can't start to rebuild it. There's a lot better solutions, a lot more potent anti-inflammatories than a regenerative technique.
Yeah.
So you need to characterize what you're dealing with before you start down that road. So, I think the biggest thing is, again, we go back to trying to prevent these. Trying to prevent them. We'll go back to when you start to notice those little things, get your horse checked out. Yeah. It may be little, but get them checked out.
Yeah. So. Little things can turn into big things very quickly, and that's a horse in a nutshell. So.
Yes. Over-exaggeration everywhere.
Yes. But yeah, I think that's really helpful. I do think, a lot of people, it is starting to change. People are starting to look at their horses as athletes, and as they should, and we're starting to treat them more that way, and I'm hoping that we see less and less of these injuries, but they still are going to happen.
And that's a good thing to talk about, is people are always like, what could have I done to prevent this? What did I do wrong that caused this? One of the things I tell people is you have an athlete.
Injuries are going to happen.
It's going to happen.
Yeah.
You can do everything perfectly, and we're still going to have an injury. I mean, you look at these major league athletes. Acuna for the Braves tore his ACL last year. That man's an athlete. He's got the finest care in the world. People constantly watching his performance. Yeah. He still tore an ACL. I mean, there's pictures that, they have pitching coaches. They have tons of people watching them, athletic trainers. They still end up with injuries to their arm. Yeah. It's just the nature. If you're going to have an athlete, you're going to have an injury. You got to go ahead and accept that. Yeah. This is going to happen. Yeah. If you haven't had one, you just haven't had one yet. So don't feel bad if you get one, and just know this is going to happen. Yeah. And it's not fun. Nobody likes it. We all feel bad, but at the same time, we got to accept that this happened.
And you're also, you're riding a 1,300-pound animal around on toothpicks. So
yes.
That's, there's a lot of stress and strain on those legs, and they're built to withstand it for the most part, but it's just part of it. It's going to happen.
And the thing is, you look at these horses, and it's like most of them that get hurt, they got hurt because they tried. Yeah. Like, these horses like what they do. Or they would not do it. Yeah. You can't make 1,300 pounds do anything it doesn't want to do. No. I mean, I remember watching race horses. Race horses like to race or they don't. I mean, horses like to jump or
Once
they don't.
Once you've seen one just sit back on the gate and just not move, you're like, okay.
Yeah, he don't want to run. I got some horses like, I just don't want to jump.
Yeah.
They just don't like it.
Do it. Yeah.
But the ones that like it, oh man,
love it.
You can see a look in their eyes, like, let's go. Yeah. and that's the thing, is that everybody's like, it's always the good ones that get hurt. What's the good ones that try hard enough?
They want to do it, yeah.
Like, they try hard.
They're going to put that extra little effort in to do it, and then it's like, oh, well, crap.
So
it's just part of it.
And I'd probably say the biggest thing is talk to your vet and find out what you need to be doing. You do everything you can to prevent it. Talk to your vet. Figure out how to prevent these things. Yeah. Have an exercise plan in place. Consult with your trainers. Have a good exercise program in place. Have a good training program.
Yeah, and I think going in with a plan and not just, going out every day and willy-nilly like, oh, I'm going to do this today, and then you get sidetracked and do something. Like, have a plan and stick to the plan.
Like, my trainers, like, if there's a big show coming up, they're planning weeks out on how we're going to be prepared for that. Yeah. like I know like pony finals is coming up here in the summer, and I'm already talking to a lot of my trainers, like, this is what we're doing leading up to it. These are the things that we're going to do.
Yeah.
This is, when do you need to see them? When do you need to look at them for things? And so we have a whole plan getting ready for an event like that, because it's a big event.
Yeah.
And so I think that's really important is having that plan.
Yeah. And also I think just making sure that they're healthy in all the other ways and they're as fit as possible. And, we've gotten any lingering lameness issues taken care of so that they can be sound and healthy enough to do the job and not have compensatory injuries and things like that.
And I think another thing that gets forgotten is nutrition.
Yeah.
Having good nutrition so you can have proper muscle development.
Yeah. And recovery.
Yeah. Yes. Again, you have an athlete. They have to eat like an athlete. They have to be healthy. They don't need to be skinny. Everybody's like, oh, athletes are thin. I need, no. They need to be properly conditioned, proper body condition score, proper muscle development. Yeah. This takes quality nutrition and the right nutrition.
The body can't repair on maintenance.
Right.
It has to repair on a repair, like a over maintenance. And again, diet.
You're not going to, like, human athletes are not going to be human athletes long if they're living off, Twinkies and boxed macaroni and cheese.
Yeah.
I mean, you need quality nutrition.
Yeah.
And I think that's a big part of preventing these as well.
Yeah, for sure.
So
you got to fuel the body in all the ways.
Yes. So that was kind of that's a pretty superficial overview on soft tissue injuries, but I think it's a good place to start.
Yeah.
We'll definitely do some deeper dives in the future and kind of get into some of these treatments. I already did one. We have podcasts on Renova. If you haven't listened to that, check it out.
And then the Beamer podcast is really good too.
Beamer podcast, because all these things I do think help.
Yeah.
And it's just understanding how to use them and when.
Yeah.
So, that's kind of fun. Like, and we kind of wanted to, like, it's been interesting on this podcast as we've been looking at some of the data and how many countries we're in. I think
so many.
It's kind of cool, like 59 countries.
Yeah.
So we want to give a shout out to some people that are listening. South Africa, we have a huge South African following. I don't know how that happened, but we've got a huge South African following. So everybody in South Africa listening, thank you.
Yeah,
we appreciate
really cool.
it. We really enjoy doing this, and we're like, our listeners are what make this so much fun.
Yeah.
I got recognized the other day.
Did you?
Yeah, somebody recognized me from the podcast, and I thought that was kind of cool.
That
it's
is
like
cool.
People are actually watching this.
That is awesome.
So it's been really great. So being part of that, our listeners are a big part of the show. So I want you to keep, I'm going to ask our listeners, keep liking us, following us, sharing us, subscribing, tell your friends about us.
Yeah.
Keep sending questions in. We get a ton of them. I mean, we've got a board in there that's like huge.
It's a whole wall.
Yeah, and bear with us, be patient. We're trying to get to them all. Some topics are easier to cover than others.
Well, and we do have real jobs that we have to do. So.
We do.
But yeah, it's really fun. It's I think when we started this, it's gotten to be a lot bigger than we expected, but it's good. I love it.
We thought a few people around here would listen, and that's not the case. We got them all over the world, and it's a lot of fun. And I think that's the reason we keep doing it. We don't get paid for this. We just like doing it, like getting good information out there and talking to people. So, again, our listeners in South Africa, April wrote down the name, and I can't even start to pronounce that. So just know, our South African folks, we thank you for listening in.
Yes.
So, all right. Well, I think that kind of wraps up today. Dr. Caitlyn, thanks for being here.
Absolutely. Thank you.
Listeners, thanks for listening. We'll see y'all in a few. We'll see y'all next week. Thanks. Bye.